Hello, and welcome to the 2018 State Plan Open Enrollment. My name's Melanie Denning, and I'm with the Department of Administration, Healthcare and Benefits Division. Thank you for taking time today to learn about the State of Montana Benefits Plan, or the State Plan's 2018 Open Enrollment period, and how it affects you. Please be aware that the presentation may be viewed by employees, legislators, and COBRA members. So there are times that not all processes will be exactly the same. During October, employees will be receiving numerous reminders and communication pieces from Healthcare and Benefits Division regarding the 2018 open enrollment period. Employees may see posters in their workplaces regarding presentations and benefit enrollment system access. All employees will receive an open enrollment booklet in the mail, as well as legislators. Numerous reminder emails will be sent, and there will be 3 employee webcasts to view and a pre-recorded version of this presentation available to access anytime on the website. There will be pop-up reminders from the SABRE system during the open enrollment period that will remind employees to complete their benefit elections by November 3rd. Open enrollment booklets are mailed starting the 2nd week of October, and the booklet is also posted online. Information regarding open enrollment is also housed at /open enrollment. If you're a legislator or COBRA participant, you'll need to make sure any open enrollment changes you wish to make have been provided to Healthcare and Benefits Division by November 3rd. Webcasts will take place on Tuesday, October 17th at 10 a.m., Wednesday, October 18th at 2 p.m., and Thursday, October 19th at 1 p.m. If state plan members cannot attend one of the scheduled online webcasts, there will be a link on the open enrollment website, www.benefits.mt.gov/open enrollment, that the link will go to a pre-recorded employee presentation that will be viewed at any time. If employees have any issues connecting, they should contact their agency IT department. Pre-registration is not required for any of the webcasts, and closed captioning will be available only on the pre-recorded version found on www.benefits.mt.gov/open enrollment. Jump into the 2018 state plan renewal and open enrollment period information. I wanted to take time to remind employees that the State of Montana Benefit Plan, or the state plan, is self-funded. The state plan is funded by monthly employer contributions and employee contributions. These contributions are held by the state plan and used to pay state plan expenses, the vast majority of which are claims. As noted by the Department of Administration Director John Lewis in the open enrollment booklet mailed to all state employees, legislators, retirees, and COBRA participants, the state plan members have done a great job of managing their medical-related costs. Medical expenses this year for 2016 trend were actually down some, coming in at $137 million on medical. Prescription expenses rose $2 million, and dental-related expenses remained stable at $8 million. When you balance our income with our expenses, you get the state plan reserve. What are state plan reserves used for? State plan reserves are needed because we can't control all of the variables surrounding operating a state plan. We are able to control many of our plan costs, but there are some things we don't have direct control over, which include our largest income source, the employer contribution. The employer contribution is set by the legislature every 2 years, and HCBD works hard to provide funding recommendations, but ultimately has to comply with the funding set by legislature. Next, federal mandates are also directly impacting the state plan expenses. For example, this year, the state plan has been required to cover statins, which are cholesterol-lowering medications, at a $0 copay due to the Affordable Health Care Act, or ACA. Medical trend, the increasing cost of medical care, is a huge variable the state plan has little control over. The cost of medical procedures and prescription medications continues to rise year after year. And finally, Healthcare and Benefits division works hard to estimate and evaluate expenses so that we have a general idea of the volume of claims in a given year, but there can be surprises. For example, one year we might not see any claims for premature infants, and the next year we may see 5, resulting in millions of dollars of claims. The state plan needs to always have enough money in reserves to cover all 30,000 plus members when they need us. State plan rates for medical, prescription, dental, and vision are not changing for 2018. The employer contribution has also remained the same as set by legislature. This means that the monthly contributions will stay exactly the same for 2018. We're so pleased to be sharing this good news with you. It feels like a gift. Additionally, we are excited to announce that life insurance plan rates for employee supplemental life, spouse supplemental life, and dependent life have decreased effective January 1st, 2018. The 2018 plan rates have been posted on the HCBD website at www.benefits.mt.gov. 2017, Healthcare and Benefits began presenting rate information in a way that showed employees their actual out-of-pocket contribution in an easy-to-understand format, and has been well received. It is easier than ever for employees to understand what their monthly out-of-pocket contribution is. In addition, the SABR's new employee and open enrollment system has also been updated and also reads in this easy-to-understand format. This slide reflects the employee's out-of-pocket contribution required for enrollment in medical, dental, and vision hardware. Additionally, it shows the long-term disability plan cost. This information is included in the open enrollment booklet that was mailed to all State of Montana employees the second week of October. Please be aware that if you are a legislator or a COBRA beneficiary, your out-of-pocket contributions may be different and are reflected in the open enrollment booklet that was mailed directly to you. Additionally, as a legislator or a COBRA recipient, you may only be eligible for certain benefit plans based on your state plan status. You should refer to your open enrollment booklet for verification of eligibility. The open enrollment booklet also gives general cost information about flexible spending accounts and the life insurance plans. Life insurance plans for employee supplemental life, spouse supplemental life, and dependent life have all decreased effective January 1st. In addition to no rate increases for employer or employee monthly contributions, there will also be no changes to the medical plan out-of-pocket costs. This means that your medical plan copays, your deductibles, and maximum out-of-pocket costs will stay the same for 2018. You can refer to the open enrollment booklet, the HCBD website, or the WRAP plan document for additional state plan coverage information. Benefit changes. Applied Behavioral Analysis, or ABA treatment. The state of Montana has adopted a licensing process for ABA therapists. Effective April 1st, 2018, the state plan will only pay ABA claims submitted by a licensed ABA therapist. Cholesterol medications, or statins. Effective January 1st, 2018, Affordable Health Care Act, or ACA, requires cholesterol medications like Lipitor or similar equivalents to be covered as a preventive treatment at no member copay. The Navitas formulary will apply, and additional questions that you have should be directed to Navitas Health Solutions at 866-333-2757 or www.navitas.com. Diabetic test strips. Effective January 1st, 2018, all diabetic test strips will apply a Tier 2 or $50 copay under the Navitas prescription drug program. The Navitas formulary will apply, and additional questions should be directed to Navitas Health Solutions at 866-333-2757 or www.navitas.com. Next, medical FSA limit increase. The IRS has increased the annual limit allowed for the medical flexible spending account contributions from $2,550 to $2,600. The non-ambulance travel benefit. This benefit was added to the state plan effective 7/1/2016 as a way to assist members who may need to travel to a non-participating facility or hospital for services. Effective January 1st, 2018, the non-ambulance travel benefit is being removed from the state plan due to the fact that all facilities and hospitals within the state of Montana are participating with the state. Employees will need to be aware that if they do not make an active flexible spending account election for 2018, and they do have a flexible spending account debit card, the card will be terminated effective January 1st, 2018, and claims will need to be submitted online or via email. Debit cards are only available during plan years in which employees have an active FSA election. Rollover does not count as an active FSA election. Access to rollover funds is available via online or mail claim submissions. The open enrollment period runs from October 20th to November 3rd. Employees have from October 20th to November 3rd to log into the Mine site and make benefit elections for the 2018 plan year. Employees will see a Sabres pop-up each Friday through the open enrollment period when logging into work computers, reminding them to complete their open enrollment elections. Just like with the charitable giving campaign, this pop-up will happen even if the elections have already been completed. Employees can change and resubmit their elections as many times as they want, but whatever choices have been submitted on November 3rd will be their final election. Please note, legislators will have until November 3rd to return their open enrollment election form, and if returning the form via mail, it must be postmarked by November 3rd. Legislators do not have access to the Mine system and will not be able to complete their open enrollment election online. COBRA beneficiaries must notify Healthcare and Benefits Division by November 3rd if they wish to make changes to their benefit coverage. COBRA beneficiaries should contact Healthcare and Benefits via phone at 800-287-8266 or email benefits questions at mt.gov with any open enrollment changes. During the open enrollment period, employees can make changes to their coverage like enrolling or waiving the state plan. They can change life insurance and long-term disability elections, and they can also add or delete dependents from the plan. This is also the time to elect or re-elect the Vision hardware plan and enroll or re-enroll in flexible spending accounts. As a reminder, if you're a legislator or a COBRA beneficiary, you may only be eligible for certain benefit plans based on your state plan status. You should refer to your open enrollment booklet for verification of eligibility. Joint Core. The open enrollment period is also a time employees can elect to be Joint Core. If you and your spouse or domestic partner both work for the state and are eligible for benefits, and you have a dependent child or children covered on the state plan, you should be Joint Core. Being Joint Core means that you have one shared family maximum out-of-pocket, and the rate is better than being an employee and family and employee-only coverage. For more information on this, contact Healthcare and Benefits Division. If you do not complete an open enrollment election, you will have the same medical, dental, life insurance, and long-term disability coverage that you currently have in 2017 for the entire 2018 plan year, unless you qualify for a special enrollment period. Additionally, if you do nothing, enrollment in the medical or dependent care flexible spending accounts and the Vision hardware plan will terminate effective January 1st, 2018. If employees have more than $120 of medical flexible spending contributions available in their account at year end, these contributions will roll over from 2017 to 2018 and will be available for 2018 medical expenses. Please be aware that employees have to re-elect flexible spending accounts and the Vision hardware plan every year. The open enrollment period runs from October 20th to November 3rd, and employees have from October 20th to November 3rd to log into the Mine site and make benefit elections for the 2018 plan year. Employees can change and resubmit their elections as many times as they want, but whatever choices have been submitted on November 3rd will be their final election. Employees can complete an open enrollment election from work by logging on to the Mine site. Remember, legislators will have until November 3rd to return their open enrollment election form, and COBRA participants must notify Healthcare and Benefits by November 3rd of any open enrollment changes. Legislators and COBRA beneficiaries do not have access to the Mine system and will not be able to complete their open enrollment election online. The next few slides are only applicable to active employees. How to make elections from home. Open enrollment elections can also be completed from home by going to www.mt.gov/employee and clicking on the Mine self-service portal. Then log into the Mine site and follow the instructions just like you would from work. From work or home, employees can complete open enrollment elections by logging into Mine and clicking on the Human Resources tab. The open enrollment system will only be available from October 20th to November 3rd. If an employee fails to complete their election by November 3rd, they will not be given another open enrollment opportunity. Once the tiles open, click on the Benefit Details. Choose Benefits Enrollment, and employees will see their name at the top. Locate the green Begin button and click on it. Although the process to access the open enrollment event has changed, the open enrollment system functions the same as it has in the past once you hit Begin. Once the enrollment event opens, employees will scroll through each enrollment section, and if changes are needed, they will click the Edit button in each section. Employees will see their actual biweekly out-of-pocket contribution amount for each benefit. Please be aware, the open enrollment booklet shows employee contributions per month, and the open enrollment system shows employee contributions biweekly. The open enrollment system has been updated from previous years to show just the employee out-of-pocket contribution amount. It does not include the employer contribution. Once you complete your enrollment in each benefit, you will see a summary of your elections and the biweekly out-of-pocket costs for each. The Next Step Incentive row reflects the incentive amount you and/or your covered spouse or domestic partner have earned in the MyActive Health portal as of September 30th. Please be aware that this amount is not your final incentive earned. And if you have recently completed Live Life Well activities or self-reported next steps in the MyActive Health portal, you should refer to the MyActive Health portal for the most current information regarding your incentive status. Since the Live Life Well incentive program does not end until October 31st of 2017, the final incentive cannot be loaded into the Sabre system until after that date. Your final confirmation statement that you receive in December 2017 will reflect your final incentive earned. At the bottom of this page, you will see your first Submit button. Click it. Is the Benefits Enrollment Important Message screen. If you have made a change to your life insurance coverage that requires Evidence of Insurability, or EOI, you will see this reminder page. Once you have reviewed, click the Continue button to get to the next Benefits Enrollment page. The next Benefits Enrollment page provides a summary of the important enrollment reminders. To continue to the Submit Confirmation page, click the Submit button. Once you hit the Submit button on the Benefits Enrollment page, you will see the Submit Confirmation page. If you want to see a confirmation of your benefit elections, click the Confirmation Statement button at the top of the screen. And remember, you can go back and resubmit changes to your elections as many times as you want until November 3rd. But be aware, you will need to make sure you finalize your elections by clicking Submit twice. The final Submit button is on the Benefits Enrollment page. If you want to see your confirmation of benefit statement again, you'll have to go back through the election system to return to this page. The Submit Confirmation page has some very important information about things you may need to take action on and the links to do those things, so please read it carefully. You won't be able to view your elections during the month of November as work is done behind the scenes getting ready for 2018. In December, employees will be able to see their 2018 benefit elections by following directions on this screen. HCBD will send you an email with this information once the final confirmation statements are available. When you submit your elections in the MineSite, you will not get an automatic confirmation email. You will only see the confirmation page as shown. Once you have fully reviewed the Submit Confirmation page, click the OK button. This completes the If you made first-time election or elected an increase of more than $10,000 to the Employee Supplemental Life, or made a first-time election or elected an increase to the Spouse Supplemental Life, and or made a new election of long-term disability LTD coverage, you must complete Evidence of Insurability Application, EOI, and receive approval from the standard before the newly elected coverage will be in effect. Again, you will not receive a reminder to complete the EOI. Information employees need to know to complete the EOI is available at www.benefits.mt.gov/open-enrollment. The confirmation page contains important information on items that may require your action. If you add a spouse or domestic partner or child or children to the plan, you must submit the appropriate verification of eligibility documentation to Healthcare and Benefits Division by December 15th, 2017. Healthcare and Benefits will not send you a reminder about this. Information about verification of eligibility can be found on our website at www.benefits.mt.gov/open-enrollment. If you fail to provide the appropriate dependent verification documentation on any dependent you enroll during the open enrollment period, they will not be added to your state plan coverage effective January 1st, 2018. Here are some important state plan reminders. Air ambulance transport. The Montana Legislature passed Senate Bill 44, which pertains to emergent flights provided by non-participating air ambulance transport companies that are not controlled by a Montana hospital. The bill requires the state plan to make payment based on bill charges or a negotiated amount or the participating provider contracted amount. The state plan pays at 250% of Medicare, which is a participating provider amount. In this case, a member is held harmless except for the deductible, etc. There are still circumstances where a member may be balance billed. Contact Allegiance at 855-999-1057 with any questions. Participating providers. Participating providers and facilities have contracted with Allegiance in Montana and Cigna outside of Montana to accept a low fair rate for your care. Check if your provider and or facility are participating before you go. Visit www.askallegiance.com/SOM or call 855-999-1057. Retail pharmacy fill. Remember, you may receive up to a 90-day supply of medication from your participating retail pharmacy for 2 copays. This is also the case for the participating mail. State plan members cannot use the state plan, including the Montana Health Center, for any work-related injury or illness. If you or anyone covered by the state plan gets hurt or sick while working, that is not covered by the state of Montana plan, even if you have a work comp waiver. Also, if you're considering retiring soon and you will be over 65, you must have Medicare Parts A and B, and you will be automatically enrolled in the state plan Part D prescription drug coverage. You cannot sign up for any other Part D coverage. If you do, you will not be allowed to stay on the state plan benefits. You may have the option to stay on the state plan, but you may have other options that will be more financially beneficial for you than staying on the state plan. This includes the health insurance marketplace at www.healthcare.gov if you're under 65, and the Medicare supplements or Advantage plans if you're over 65. For more information on those, please contact a state health insurance program or SHIP representative in your area by calling 800-551-3191. 2017 Live Life Well incentive deadline is October 31st, 2017. Don't miss out. Hopefully you've already had a state-sponsored health screening, and remember you must complete a state-sponsored health screening to receive any of the incentive. That's $5 a month off your 2018 benefit payment. We have added an extra screening opportunities at the state of Montana Health Center locations for October, but we cannot guarantee that you can get in if you have waited. If you complete a state-sponsored health screening, you were tested for nicotine in that health screening, and if you're nicotine-free, that's another $10 a month off. If you are not nicotine-free and still wish to earn the incentive, you must complete and self-report that you completed an alternate activity. Lastly, you must self-report your next step activity to receive the remaining $15 for a potential total of $30 a month reduction in 2018. If you want to earn the $15 next step incentive, you must also report your activity in My Active Health site. Even if you did a wellness challenge like the Governor's Stay Active Challenge, you still need to report it. If you are not nicotine-free, but did an alternative like a nicotine cessation program, you have to self-report that as well. Log in to www.myactivehealth.com/SOM portal and click on the My Rewards tab. That tab is on the left, and then click Result or Work on it under the Next Step Incentive tab. In order to get credit for any next step activity, you must report that you completed the activity in the My Active Health portal. You must report all activities, including the Governor's Stay Active Challenge. Once you report the activity is completed and it says Complete in the portal, you should see Completed in the comments column. It can take a day or two for the system to update your incentive progress once you self-report your activity. If you report a next step activity, but your state-sponsored health screening has not yet been reported to My Active Health, the portal will save your self-reported information but won't show any incentive progress until your state-sponsored health screening has been reported. (2018) Live Life Well Incentive. Changes are ahead for the 2018 Live Life Well Incentive Program. Earn $30 a month off your 2019 benefit contribution, and you may double your incentive if a covered spouse or domestic partner also participates. You must complete all 3 activities: health screening, be nicotine-free or self-report an alternative, and self-report next step activity between November 1st, 2017 and October 31st, 2018 to earn any incentive. For 2018, the nicotine testing is no longer done via the health screening. You must self-report this activity for 2018 in the myactivehealth.com portal. This change has been made as the state plan did not see a large increase in the number of positive test results during the years nicotine testing was completed via the health screening versus the number of self-reports completed in previous years. Additionally, similar to other agencies, HCBD has been tasked with implementing cost-saving solutions, and this change results in significant state plan savings without reducing benefits. You will keep track of your incentive and your self-report in your activities in the myActiveHealth portal. If there is any medical reason that you can't do any parts of the Live Life Well incentive, there are exceptions and alternatives available. Please call the Healthcare and Benefits Division to learn more. During and after open enrollment, watch your mail and email for some important documents coming from Healthcare and Benefits Division. This will include your 2018 WRAP Plan Document, or WPD, formerly referred to as the Summary Plan Document, or SPD. That's the big booklet that outlines everything that's covered and all the plan details. You will also receive a Summary of Benefits Coverage, which is a legal document required by the Affordable Health Care Act. It's a short summary of our plan. You will also receive a Medicare Part D creditable coverage letter and a few other legal notices. Attending today, please check our website frequently for updates. We have posted health screening and flu shot schedules, incentive information, etc. So call or email us with any questions. We want to hear from you.